Hi there, this is Colin from Joint Dynamics. I'm a physiotherapist here. We're talking this month about men's health and our prostate care. One of the things that someone might come to see a men's health physiotherapist for is erectile dysfunction. It's not the first thing you'd think about going to see a physio for, but sometimes there are real physical problems. And we've talked about using the ultrasound to visualize the pelvic floor, but this can really impact a man's ability to have an erection or keep an erection. Now, always there's a psychological component that goes with this, but it's not always caused by psychology. So for example, we can have blocked blood vessels in the penis, and that can inhibit blood flow into the penis so that a man can't even attain an erection. And this can be treated with shockwave therapy, which sounds much worse than it actually is, but it's something that physiotherapists can do. We work with urologists and sexual health physicians. One of the other things that can happen is that the pelvic floor, the muscles of the pelvic floor, can just be too tight, and they can either stop blood flowing into the penis, or they can allow it to go in part way and you get sort of a semi-hard erection. What we would do as a physiotherapist is we'd examine the pelvic floor both visually with the ultrasound machine, but also, unfortunately, we would do a rectal exam just to see how tight the pelvic floor is. There are manual techniques, trigger point techniques that can help release this, as well as deep breathing exercises and things that can make the journey much easier for a guy. We work closely with a physician and with a psychologist to help you transition through this. One of the tools we use to examine somebody's pelvic floor is the ultrasound machine. And we need some information about how strong a contraction, how regular a contraction, a guy can give us that will help his pelvic floor before prostate surgery. There's a big risk with prostate surgery for incontinence afterwards, the urinary incontinence. And one of the things we can do is we can strengthen the pelvic floor beforehand, and this has been shown to reduce this incidence and the time that someone will have urinary incontinence for. So what we would do is we would use a probe and we would examine on the perineum the pelvic floor, so we can shoot up and we can show visually what's happening with the pelvic floor. And there are a couple of things we need to know. We need to know if a man can generate a contraction in his pelvic floor in 3 different ways. Now, without trying to offend anyone, the first thing we need to know, part of their pelvic floor, is can they contract their anal sphincter? So we basically say you have to stop yourself pooing. Can you do that? The second thing we need to know is that the next part of the pelvic floor, the cue is nuts to guts, and believe it or not, someone has researched this as to what cues a man can understand. And nuts to guts is basically, can you feel a lift in your testicles when you contract your pelvic floor? And the third contraction you need to look at is the external urethral sphincter, or basically, we need to visualize the penis as the head of a turtle, and can you pull it in? And what would happen is we would check each of those contractions individually. We need to know how strong they are, how much endurance they have, and how quick they can fire. And then we're going to look at them in a sequence. It's important to use the ultrasound machine for this because it gives us accurate visualization of what's going on. So what we would do is we would gel up the probe and we'd be placing it on the perineum, and we'd be working in here and we would have a look and see exactly what's going on. So we know that this is ultimately the best way of visualizing the pelvic floor for our customers. So physiotherapy may not be your first thought for erectile dysfunction, but it can certainly be part of the solution. Thanks.